edition of the Dr. APJ Abdul Kalam Memorial Oration organized by Medical Education Department, KGMU. It is my proud privilege to welcome the esteemed dignitaries on the dais. May I request Dr. Shuli to please kindly escort the dignitaries on the dais. Professor Sonia Nityanand, Honorable Vice Chancellor, KGMU. Professor Avinash Supe, our esteemed orator for the day. Professor Abjit Kaur, Pro Vice Chancellor, KGMU. Professor Amita Jain, Dean Academics, KGMU. Professor Vimla Venkatesh, Vice Dean Academics, KGMU. And Professor Amita Pandey, HOD Medical Education Department, KGMU. Dr. APJ Abdul Kalam said, and I quote, "Learning gives creativity, creativity leads to thinking, thinking provides knowledge, and knowledge makes you great." The 11th President of India, fondly remembered as People's President, Dr. APJ Abdul Kalam's legacy as an inspiring leader, innovative scientist, and a compassionate educator continues to ignite minds and nurture the dreams of countless students and professionals across the globe. His teachings have reminded us that innovation in education is not just about new techniques or technologies, but about fostering a mindset that encourages questioning, learning, and applying knowledge for the betterment of the society. Also, 15th October marks the birth date of Dr. Kalam, and keeping in mind the vision of Dr. APJ Kalam that how education is the best weapon that can change the world, this oration is dedicated to his life and his teachings. Now, taking the program forward, we formally welcome our esteemed dignitaries with a token of respect and appreciation as a symbol of our gratitude for their presence. May I now request Dr. Shuchi Tripathi to welcome Professor Sonia Nityanand, Honorable Vice Chancellor, KGMU. To welcome Professor Avinash Supe, our esteemed orator for the day. Professor Abjit Kaur, Pro VC, KGMU. Professor Amita Jain, ma'am, Dean Academics, KGMU. Professor Vimla Venkatesh, Vice Dean, KGMU. And Professor Amita Pandey, HOD Medical Education Department. Thank you, Dr. Shuchi. With deep reverence and humility, we invoke the blessings of Ma Saraswati, the goddess of knowledge, wisdom, and learning. I would now invite the dignitaries to please come forward and light the pious lamp of learning. Thank you, dignitaries. Taking the program forward, I now kindly invite Professor Amita Pandey, the dynamic HOD, Medical Education Department, to come and deliver the welcome address.
Professor Sonia Nityanand, ma'am, Honorable Vice Chancellor, King George's Medical University, Professor Avinash N. Supe, the guest orator for today's function, our Pro Vice Chancellor, Professor Abjit Kaur, ma'am, Dean Academics, Professor Amita Jain, Convener NMC Nodal Center, Professor Vimla Venkatesh, senior teachers in the audience, esteemed faculty members, and dear students. A very good afternoon to all of you and a warm welcome to this prestigious oration. The Department of Medical Education, King George's Medical University, has been organizing the Dr. APJ Abdul Kalam Memorial Oration for the past 7 years in the month of October to celebrate the birth anniversary and to pay homage to our legendary and iconic president, Dr. APJ Abdul Kalam, whose birthday happens to be on the 15th of October. For this oration, every year, we invite an eminent scholar from the field of medical education to share his or her vision on some pertinent aspect of medical education and to sensitize our faculty about modern concepts of medical teaching, learning, and assessment. Today, we are honored and privileged to have Professor Avinash Supe, an authority in the field of medical education, with us to deliver this coveted and prestigious oration. Sir, we are indeed extremely grateful to you for accepting our request, and on behalf of King George's Medical University, I welcome you. We are all eagerly looking forward to your enlightening talk.
Thank you so much, ma'am, for those inspiring words and for your unwavering dedication to enhancing the education. I hereby invite Professor Amita Jain, esteemed Dean Academics KGMU, to address the gathering with the words of wisdom.
Good afternoon, everyone. Honorable Vice Chancellor, Professor Avinash Supe, Pro Vice Chancellor, Dr. Amita Pandey, Dr. Vimla Venkatesh, August gathering in this hall, faculty from other institutions who have kindly joined us, and dear students. Dr. APJ Abdul Kalam need no introduction. The missile man of India. This is our way to pay homage to the best, one of the best teachers of the country. He was the educator, he was the teacher, and he was, as Dr. Amita said, he was a truly people's president. I will not take much time because I know we are waiting to listen to Dr. Avinash Supe, whom we have heard all this morning, and needless to say, he is one of the best person I have ever heard on AI. So without coming in between two of you, I welcome Dr. Avinash Supe to this August gathering, and thank you very much for being here.
Thank you, ma'am, for the thought-provoking and insightful inputs. We truly appreciate your invaluable support and contribution for this event. May I now invite Professor Abjit Kaur, Pro Vice Chancellor, KGMU, to share her views and insights.
I actually have been thinking of what to say. And the most befitting word that I can think of is mesmerizing. Mesmerizing in terms of the energy you have, mesmerizing in terms of your clarity of the subject, and mesmerizing in terms of how conveniently and easily you made us dive so deep that we got an illusion that we've actually reached the bottom of the ocean. I won't stand between you and the really, really enthralling experience that awaits each one. Best wishes.
Thank you, ma'am, for those words of motivation and encouragement. It is now my great honor to invite a distinguished leader whose vision and commitment to excellence in education and research have been instrumental in guiding growth of this institution. Please join me in welcoming Dr. Sonia Nityanand, Honorable Vice Chancellor, KGMU, to address the gathering.
Thank you. Dr. Avinash Supe, who's going to give the 7th Dr. APJ Abdul Kalam Memorial Oration, and all the other dignitaries on the dais, and the faculty who's come from RML. I can see Dr. Navveer and Dr. Ritu, and all the other esteemed faculty members from the King George's Medical University and students. I'm so happy to see the students today. And a big thanks to the organizing team to invite them, because this lecture is actually meant for the students. So a very warm welcome to all of you to the 7th oration in memory of Dr. Kalam. And I think it's one of the best events that KGMU holds year after year. It's the 7th year. And we all know and appreciate the passion that Dr. Kalam had for teaching and students. And I don't think we could have got a better orator today than Dr. Avinash Supe, because we've seen that streak of passion for teaching and sharing his knowledge and expertise in the morning workshop that had been organized by Dr. Amita Pandey. It was phenomenal. Of course, the way he taught was phenomenal, and the topic that he taught on, the workshop, was itself very phenomenal. So thank you, Dr. Supe, for being with us and for agreeing to give this oration. And I must say that the topic is something which is of the interest of KGMU, because we do want to foster a creative thinking and innovation in our faculty, in our students. So your topic is also very appropriate about speaking on fostering critical thinking, creativity, and innovations in students. This is what is one of our main goals in KGMU. So I welcome you, sir, for this oration, and all the best. Thank you.
Thank you so much, ma'am. Your vision and insights have added great value to today's program and have motivated us all to strive for excellence for further educational endeavors. I hereby invite Professor Amita Pandey to come and introduce our esteemed orator for today.
With great pleasure, I introduce Professor Avinash Nivritti Supe, our esteemed guest for today's oration. A renowned gastrointestinal surgeon, Professor Supe is the ex-director and Dean Medical Education and Emeritus Professor of Surgical Gastroenterology and Medical Education at St. G.S. Medical College, Mumbai. Trained at Memorial Sloan Catering Center, New York and Hamburg, Professor Supe has many degrees to his credit, including the prestigious FRCS from Edinburgh University, Master in Health Profession Education from the University of Illinois, Chicago, USA. A leading expert in medical education, he is the founder director of FAMER Regional Institute at St. G.S. Medical College, Mumbai, and the past president of Academy of Health Profession Educators of India. At present, Professor Supe is the director, clinical governance at Hinduja Hospital and consultant GI surgeon at Zen Hospital, Chembur, Mumbai. An outstanding GI surgeon, Sir has been the chairman of GI surgery in National Board of Examinations, ex-chairman Expert Group National Medical Commission, past president Indian Association of Surgical Gastroenterologists, ex-chairman State COVID Death Analysis Committee, and many more. And academician par excellence, Sir is the recipient of the coveted Dr. B.C. Roy Award, the Maharashtra Bhushan Award 2019, and countless other state, national, and international awards. An avid researcher, Professor Supe has published widely and figures in the Stanford University list of top 2% scientists in 2023 and 2024. His versatility can be inferred from the fact that he is an honorary member of the Photographic Society of India, owing to his rich contribution to medical, nature, and wildlife photography. He has received the Centurion Donor Award from Government of India for donating blood more than 126 times. There is more, my dear friends. He is a prolific writer, and his columns are published regularly in Indian Express, Free Press, Lok Satta, Lok Prabha, Maharashtra Times, and many more such newspapers and dailies. He is an enthusiastic trekker also, who has hiked the Himalayas, Sayyadaris, Kailash Mansarovar, Everest Base Camp, South America, Arctic Circle, and Antarctica. So we are all in awe of your towering personality, sir. It is indeed an honor for our medical university to have an orator like you. A warm welcome to this university.
Those were very impressive credentials indeed. May we have a big round of applause for Professor Avinash Supe. I now request our Honorable Vice Chancellor and other dignitaries to please come forward and felicitate Professor Avinash Supe, sir. Thank you, dignitaries. Now, with all respect, I invite Professor Avinash Supe to come and deliver the Dr. APJ Abdul Kalam Oration on fostering critical thinking, creativity, and innovation in students.
At that time, we had one student's program, and one of our students just wrote a mail to him, will you come to the Trinity and attend that program? He just said, yes, I'm coming. And he came. He spent he was supposed to come for only 1 hour, but he spent 3 hours. And he was so discussing. He came to my room, he sat in my chair, and he said, I want to have a coffee with you. And the kind of discussion he used to really do was amazing. I think these two interactions made me understand that why the people call him as people's president. And I think you people have started this oration in his name, which I think is the most important oration, because he was the true teacher and he was the one who really shaped many people's life, and he was always what we call in Marathi, Prerna-dayi. He was an inspirational kind of a character. I think it's okay, don't bother. He has tried his best. It's not working here. How do we go? Oh, it's coming. Should I do it there? No. Forget about it. Sorry, I think this is always a problem with Mac. B6. No, just. Did I do this? Yes. Is it coming now? Fine. Okay. Technology sometimes works. Now, I think first thing, as I told you, this was the two interactions I had with Professor Kalam. Now, let me begin with saying why people are successful, especially the Apple computers, Mahatma Gandhi sir, and Wright brothers, why they were successful. Because they thought differently. They were not same path like people really thought about it. They thought about what, how, and why. Now, I don't know how many of you really seen the 2007 presentation when iPhone was introduced. I think you can go to YouTube and see it. It's an iconic presentation. At that time, he introduced the concept of this iPhone, and it had changed everyone's life. All of us have now smartphones. And it is a small computer in my hand. And it is every day, it is increasing its power. And that was a presentation of Steve Jobs, which made complete change in our lives. So dealing with uncertainties, medical and medical education will change in next few years. All of students who are sitting here are not going to follow what you have learned in KGMU. And this is first thing you should know when you come to this hospital. Do you know what to teach to your students if you don't know what is going to happen? To give me an example, we always work with new materials, new technology, newer evidences, and changing mindsets of patients. 25 years ago, sending money from one account to another was a big task. We used to write check. I don't know how many of new generation has seen checks. We used to write them, put a slip along with that, put it in a bank. It used to go to this thing. After 2 days, we had to go and print the passbook when you know that the money is transferred. There were 20 people involved in all this. Today, do we require all this? In less than a minute, I transfer amount into somebody's account. And 20 people who were involved there have lost their job. Because everything is automatic on your smartphone. So how we have changed? If you look of risk of job being replaced by automation, it is said that so many people are likely to lose their jobs, but there will be new jobs will come. But whatever jobs were existent with it, that means what skill set I had is going to change. And I should be prepared for that change. So reinvent education to give top critical skills. So when an student comes to you, I want to give him complex problem-solving skills. So even if the new problems come, he should be able to solve them. Critical thinking, creativity, people management, emotional intelligence, judgment and decision. These are the issues of Generation Z. I think we need to solve those issues. We are not interested in giving them the same PowerPoint which we give for last 20 years. So Education 3.0 is away from information memorization, and brute force recall should be now irrelevant. Everybody has knowledge. On my mobile is everything there. Problem solving, curiosity and innovations are going to be the key. So students have transformed from passive to active, completing to creativity, rigid to fluid, dependent to autonomous. And teachers also have to transform to the student-centered, facilitator rather than teacher. Once we understand this is our role, we need to change. So there is to be new tools. We need to have critical thinking, creativity, innovations, and entrepreneurship. These are the new tools which we should teach our students. So let's think about critical thinking. What is critical thinking actually? Is the ability to evaluate information and aware of biases and assumptions, including your own. Now, we should be able to look into ourselves to make it critical thinking. Critical thinking means making reasonable judgments. So look at this video. Are you able to get sound? It's okay. Sherlock Holmes. And what Sherlock Holmes is trying to say in this video is that when he enters, he sees so many things on the left-hand side. And he says this person was left-handed. Now, when we start working on these kind of videos and we see these, I don't know, videos, but I always feel that when I see Sherlock Holmes videos, I get always this is loose. Okay. Sure. So anyway, I hope it runs. Now, if you see this kind of an puzzle, who will shout first? You know, the 4 criminals were caught in minor offense and they were pleaded judge to release them. And they were made to stand like this. And they were asked that you can see 1 and 2, you can see. So they will say, you have to say which color hat somebody is wearing. And you have to shout. If you shout rightly, probably you will get exactly what it is. Now let me see who will shout first. And this is a question I asked many medical students. And many of them were able to answer, some of them will not able to answer. Now the question is, number 2 will say rightly. Others cannot really say because number 1 is seeing 2 different color hats. Number 4 is not able to see, number 3 is not able to see. The only person who can judge is that 2 is seeing, 1 is not saying anything, therefore I will say 3. Now this is analytical judgment. Now this is exactly we make a diagnosis in a heuristic way. So can you realize the thinking of reflection? So critical thinking and clinical medicine are very close. Having a critical thinking skill for a physician helps him to make a right clinical decision. In our clinical practice, we all the time see so many patients. And we are always not sure whether this is dengue or this is malaria or anything, all kind of thing. You know, we all the time going on heuristic way. And this is where the critical thinking. So in fact, this is one wonderful book I would like to read. You want to read is Medical Student's Guide for Critical Thinking. And every medical student should really read it because it says steps of critical thinking. Determine the issue of question. Gather relevant information from all available reputable sources. Analyze. Be careful about confirmation bias. You know, everybody is biased. You know, sometimes we have different kind of biases. Synthesis and then make a decision. Most of the time we make decisions without heuristic thinking. But it's important that you bring a critical thinking to make a perfect diagnosis. So if you do a critical thinking, there are so many kind of advantages people have, like avoiding medical errors, identifying better alternative options, better clinical decision making. And there is a whole list of activities people really do. Now from critical thinking, we come to the clinical reasoning. Now clinical reasoning is very important for a clinician. I always would like to call myself as a good clinical diagnostician rather than a good kind of an image reader. ability to sort out through cluster of features presented by patient, accurately assign a diagnostic level, ability to integrate, apply in different types of knowledge. Now, if you really see this video, look at this video. What did he really tell us? That when a patient walks in our OPD, we should start analyzing patient. Every step of that patient is analytic. And from simple things, the way he walks, we can gather so much of information. And that's where, and I'm sure we are not only looking for patient, every patient's word, every patient's sentence, his attitude is going to tell us many things. So when you think about process of clinical reasoning, there's a Q acquisition, hypothesis generation, Q interpretation, and then hypothesis evaluation. We go through all this process and we create what is called as a cognitive or mental shortcuts. I'm sure your OPD is also like our OPD. 200, 300 patients sitting in OPD, and I know there's a rush all the time. We are seeing patients. We work on what is called as a cognitive shortcuts. You know, we think in our mind, we create profiles in our mind, and then we start treating our patients based on that kind of a mind. Now, every word patient speaks, we should be able to pick up. And what we say now, every senior person's uska nazar itna fix hota hai ki patient then walks in you, many times you know what the patient is having. And this is what we need to really develop. So how do we teach this clinical reasoning to our students? That is the most important challenge. Today, students come with NEET, MCQs. How do you bring in that clinical reasoning to them? So this is where we need to do brainstorming, mind mapping, lateral thinking, reflections, and debriefing. You know, a boat has a ladder that is 10 feet long and hangs on the side of the boat. What will happen if the ocean rises? The answer is very simple. The ladder will have still that tide rises, it will be still 3 feet. Now, such answers, many times people will say it is not there because they don't think that particular way. So there are a lot of educational strategies to improve technical clinical reasoning. People would really do a lot of things, and I'm sure we have been doing, encouraging students, prioritizing differential diagnosis, comparing and contrasting various DDs. 1 minute preceptor is a very good technique which many people really try. You know, the first thing is you ask student, what does he think about it? Then probe for underlying cause, provide positive feedback, correct errors, and then teach general ideas. So don't allow students and don't overfeed them. We need, see what happens up to 12th standard, they're overfed. When they come to us, open them up and give them something which is likely to occur. So these are the something micro skills you will do. There's another method called SNAPS method. You know, as a good clinician or a good, even paraclinical people, preclinical people should try these methods to explore the student and encourage critical thinking in them. And these are something which I feel they are in our health stating. We can do so many things where we can introduce this clinical thinking. Now, if you really see AI, I today talked about AI, so I will not really talk too much about AI. But AI is one which has now come into the deep enforcement learning, where now it is helping us to make decisions. But when you are trying to make a decision, critical thinking is still important, because if you don't use those clues which are given by AI correctly, we will still make mistakes. And therefore, it is very important for you to develop a personalized kind of a decision making based on all these tools. So this is the way AI works. Now, the second tool which I am going to speak about is creativity. Now, creativity can be defined as ability of power to create something. I chose this topic because Professor Abdul Kalam was creative, critical thinker, innovator, and I think this was an appropriate thing. How do we convert it into the medical education? Now, there are a lot of powerful imagination and ability to think up is always there. Now, some people always differentiate between creativity and innovations. Actually, they are close together to each other. What is novelty versus creativity? Very nice people say. Many times we get used to novelty. Now, you have to look at this parameter. What is the usefulness of it and what is novelty in all this? Now, if it is novel, but it is not useful, it is just interesting. If it is neither useful, neither novel, it is quite boring. If it is useful but not novel, it is routine. But to have it become creative, it has to be novel as well as useful. So why we get excited with a new thing and we find it useful, that becomes students from novel to creative and make them non-creative, something like this. Now, how can learning setting influences creativity? Ultimately, everything is about environment. In your university, how do you maintain educational environment? It is all about environment. Education is all about environment. Your children, the way they grow is all about environment. If you are able to creatively create an environment, so you can create compassionate and accepting environment, students' ideas and encourage autonomy and creative institutional living. I'm sure everybody has seen this video. And what does he say is very important. ऐसा स्कूल को फ्रैंचाइज बना सकता है. What was in that particular school? If you all see this movie, it was all about environment and why people are really learning. So if you really look this Cambridge University, they have an innovations and creativity chart. And in most of the universities, they will see that how do you innovate and creative atmosphere you create. So why creativity is important in medicine? Medicine brings the objective research of science. So if you really look this revised Bloom's taxonomy, I mean, you are all medical education experts. We begin from remember to evaluate. But there's a new word which is introduced in 2001, and that was creative. We need to go from absolutely remembering to creativity. For example, AWR surgery is a new thing, abdominal wall reconstruction. And from a simple thing like remembering to creative, that means starting from what is existing to create new approaches for abdominal wall surgery is something which surgeons need to do. In last 10 years, you have seen so many new surgeries have come for abdominal wall surgery, and they have completely changed the way we manage abdominal wall. So the third new tool which we have to think about is innovations. Being innovator is always hard. You're always faced with a lot of resistance. Sometimes people focus on your failures rather than successes. In 1703, slates were introduced. Simple slates. And what did people say at that time? What will they do when the slate is dropped and it breaks? They will be unable to write. This was teachers' conference in 1703. And they thought slate was an innovation which was a failure. Fountain pens came in 1914. And they say students today depend on these expensive fountain pens. They can no longer write with a straight pen or nib. We parents must not allow them to wallow such luxury in detriment. These are all gazettes. You should read all this. Then when ink came, rural American teachers said, students today depend on store-bought ink. They don't know how to make their own. Ball pen pens. I'm sure all of us use ball pens in and out. Now we use gel pens, we use all this. So ballpoint pens came in 1950. Ballpoint pens will be the ruin of education in our country. Students use these devices and then throw them away. I don't think today anybody rebuys or refills, I think those days of refill have gone. They were my days. Today students throw the pen. Computers came. There is no reason anyone would want a computer in their home. I think everybody has a mobile at hand. 640K ought to be enough for anybody. This is Bill Gates. So there are 4 types of innovations: incremental innovation, disruptive innovation, architectural innovations, and radical innovation. Now, when you're trying to break something which is a routine trend, that becomes a disruptive innovation. Now, we started one M Mitra, AI-based kind of a virtual guidance. In last 12 years, when I was a dean actually in Sion Hospital, I started this. This was nothing but AI-based advice to the mothers for 2 years. And that was an experiment which was done. So we teach mothers about what care they should take about themselves within the 1 year and then their child for 1 year. This program is now so successful. For last 14 years, it has gone across many countries. It has won many awards, and it is all AI-based. And it is managed by around 20 people, and it has gone to almost about 20 countries. And this has improved outcomes. It has decreased the malnourishment and children, maternal mortality. All these are well documented in scientific ways. So these are all now coming up. If you don't think about these innovations, you will not do. And you see better nutrition in women, iron intake in pregnancy, importance of lactation, better immunization compliance. ICMR started with medical innovation. They have a site on this where they do it. Electronic stathos in India were economical in COVID times. This was an innovation which was really done. So scientific innovations continually provide us with new means of analyzing fields. So innovative teaching and learning has also been part of this. Many of you do innovations. You understand we have a top-down approach. Their NMC says everything, how many hours to spend. But over a period of time, we need to find out some concepts of innovation within that framework. And it is easily possible. So the last tool I'm going to speak on is entrepreneurship. Why expose students to technology and innovations? Why should students really look at it? Because exposing students to technology will help them to ignite and implement innovative ideas, transforming feasible ideas into reality. Now, successful medical entrepreneurship are those who understand the market needs and can connect better with customers. Now, I remember in Mumbai, they started one lab called MICE Lab, Medical Innovations, Creativity and Entrepreneurship. And they have in fact, the first patent for USG guided ablation device for PCO was done about few days ago. So patents and trying to do new devices has been there. This was done by one of our students, but now they were gynecologists and they did, Dr. Malpani and his wife did such a wonderful job. Now, if you really see, they have such equipments in lab where students come and do experiments and do innovations. They do 3D printing, computers, electronics. BETIC program, which we worked with IIT Mumbai. This was a program where our institutions worked with BETIC, is IIT. And we created medical devices, newer devices for orthopedics, for laparoscopy, flexible instruments, so that we continue to grow along with our science. What are the needs of a surgeon? What are the needs of everything? Why not we really innovate and try to bring? So these are very successful biomedical engineering technological innovation center. This is going on for last 11 or 12 years. BETIC program has developed many new instruments. And this is from ideas to impact in an innovation ecosystem. And BETIC program, there are yearly conferences where people really present. I saw patents and KGMU. KGMU also has a lot of patents. And I think, as Madam rightly said, this is one your agenda, where you want to push your creativity and all this. Now, this is something when you're doing your routine work, you should slightly look away and look at creativity and the innovations. Now, we have a social responsibility in India because our major moral dilemma is that we are going to buy all costly from the Western world, or are we going to create for our own? And this is where the patents from institutions like yours matter a lot, and we should really respect this research. So that brings us to called as a design thinking and innovation. Now, this is a process of creative problem solving. We normally try to look at what a patient needs healthcare ecosystem, and healthcare technology. And we try to design and synthesize ideas which are needed for you. And so in medical education, design thinking is coming up in a very big way. In fact, design thinking in a healthcare to prevent chronic diseases is a CDC kind of an agenda. They are trying to look at it, how do we really do this? Now, there was one university which I used to give a talk. They started a 6-year degree course in medicine and biomedical engineering. It's a dual course. At the end of 6 years, he gets an MD medicine. At the same time, he gets an BTech. And people are then taken over all over the Europe, John Hopkins, Harvard. They want people with dual degrees because they want people to have innovations and have an interprofessional education. They want to break walls between disciplines. IIT Kanpur, School of Medicine and Engineering, they already come up with this. And look at the kind of research they bring, regenerative, molecular, virtual autopsies in India. They are now coming up in a big way. So how do we bring into our curriculums? Paradoxes of medical thinking training is it is possible for medical trainee to be possession of enormous amount of medical knowledge and still not be an effective physician. This is what today's physicians are. I call them hyposkillic patients. They know everything about on their need. The NEET scores are 720, but if I give them a patient, they are not able to treat. And it is possible for trainee to have all skills necessary for effective physician and still not be able to direct these skills towards effective patient care. Patient still does not get what he wants, though he have been certified. Now this gap we need to fill. And this is where we need creativity. So right to education, right education and right way of education. So we need to think what is the needs of future and we need to change our pathway of making it change. So how to acquire wisdom, somebody said. Information to knowledge, knowledge to wisdom and wisdom to insight. They say you live, make mistakes, learn from your mistakes, repeat step 1, 2, 3 until wisdom is acquired. So we go on learning through our mistakes. Innovations, we always fail, but we learn. So what is called as a positive teaching, that is using active learning principles. And we use a lot of medical humanities. I'm sure this is to make people wider thinking and we bring the human side of medicine. So we bring the technology and we also maintain the humanness of it. Through various resilience, film shows, working in slums. There are challenges like additional curriculum in need, working under regular classes, extra effort by teachers, funding and AI coming. So we have a top-down approach in India. Whatever government area says, NMC follows. NMC says universities follow. What university says, dean follows. Whatever dean says, teachers follow. And teachers follow what students follow. We are killing our creativity. We have a top-down approach. You understand my point? So actually, medical school or a factory, this is what Professor Harden says. We need to bring about beyond that. So if you look at USA or any other countries, they gave 10 universities to make innovative changes. And this is published in one of the Academic Medicine 2007, what Stanford did, what John Hopkins did. And it's wonderful to see how within the framework, universities change their curriculum. So we may have to think about it. So there are a lot of changing trends in medical education, which I will not really go. To summarize what I would say, as an educator, we need to prepare with resilience, perseverance, and future. Because I don't know what students are going to face in next 25 or 30 years. I have to make them so strong that they are critical thinker, problem solver, innovator. They will be able to do something creatively and they will be able to survive. If I train my student in such a way that whatever knowledge change occurs, whatever skill set need change occurs, he will be able to still stand. And if I'm able to do that kind of education in a lovely environment, positive environment, that is what then probably I think I have done my job. And that's what I personally think. So let's do it together. Thank you so much.
Thank you so much, sir. That was a wonderful insight that how a simple change of mindset can change a lot, can change a world. Now to express the gratitude of the organizing team, I hereby invite Professor Vimla Venkatesh to deliver the vote of thanks.
Good afternoon. It's my very privileged duty to deliver the vote of thanks. Honorable Vice Chancellor, Professor Sonia Nityanand, Pro Vice Chancellor, Professor Abdul, Dean Academics, Professor Amita Jain, HOD Medical Education, our guests, Dr. Farzana, Dr. Nirmala, Dr. Sucheta, Dr. Nabir, Dr. Ritu, thank you for coming. Our very honored faculty here, students who have come from many, many different branches, and of course, our guest of honor, Professor Supe. Thank you, sir, for that really wonderful lecture on fostering critical thinking, creativity, innovation, and entrepreneurship among students of health professions education. Since it was Professor APJ Kalam's birthday and it was in his honor, I used some of the tools you taught us today morning to have a quick look on what he had to say about it. And I thought what he said, learning gives creativity, creativity leads to thinking, thinking provides knowledge, and knowledge makes you great. This was the most appropriate quote I found, and I hope it is okay by you. Also, I would just like to take us through all the wonderful things that Sir told us. He told us we have to reinvent education to give the top critical skill. So I'm sorry if I have made any errors in my messages, please let me know. But I think he told us that we should go towards education 3.0 and make critical thinkers. And he told us critical thinkers are people who have reasoned judgments. And he told us about cognitive shortcuts, strategies to improve clinical thinking, deep reinforcement learning. And he told us very importantly that creativity is when novel and useful come together. And novel and useful together is finally what creates creativity. He talked about innovations. He led us from where people thought that slates would break and that would break the education system to Mitra. So he told us a whole lot about education, innovation in education. He also told us about design thinking in humanities, and he told us ended with the right way to education, which is positive teaching, resilience, and perseverance. With these messages that he has given us, I hope we all go away very much enriched. We thank you very much, sir, for coming and giving us these wonderful messages on the birthday of a great educator. Thank you.
Thank you, ma'am. Now I request all to please stand for the national anthem.